Hello, welcome everyone. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontal Temporal Disorders Unit. I'm so excited to welcome you all today to our Session 3 of our Community Forum Friday event. Today, we are joined by community expert Jennifer Pilcher for support in the time of the COVID-19 outbreak. Jennifer Pilcher is the owner and executive director of Clear Guidance. Dr. Pilcher is an amazing life care manager who's developed expertise around working with our families living with frontal temporal disorders, Alzheimer's disease, and related conditions with a focus on families living life with young onset dementia. Dr. Pilcher will talk to us today about ways that we can make plans to take action during this time of uncertainty to take care of ourselves and our loved ones. Jennifer?
Thank you so much, Katie. What a nice introduction. I want to start off by saying that your job as caregivers is already hard enough. And this added burden of dealing with the virus, I'm sure, is very challenging. And so I hope that what we're presenting today will be of some use to you, give you some tools to prepare for what's ahead, and to answer any questions you might have about the specific challenges that you're facing.
And Jennifer, now you've mentioned that, I forgot to tell folks that they can use the Q&A button at the bottom of their screen, and I will moderate those questions for Jennifer. And just so that everyone knows, we are recording this event and it will be posted to our MGH FTD unit YouTube channel after. So thank you, Jennifer, for that reminder.
So what I'm going to do is I'm going to talk to you about some of the issues that I'm aware of, some of the things that are coming to our attention in our practice by talking with families that are struggling to caregive at this point. And so I'm going to give you a little bit of a presentation, and then after that, I'm happy to hear what questions, and Katie will also throw me some questions as well, based on what we're all hearing out there about what's challenging at the moment. So I think one of the things that's a primary concern of a lot of the caregivers that we're working with is, how do I manage at home with my loved one, given the fact that our routine and schedule is totally disrupted. We can't leave the house, and some of you may have been sending your loved one to a day program or other activities that were giving you a respite that you're no longer able to do. And so a lot of the questions are, how do I deal with this? And so one of our major things that we've been working on with families is creating a routine and a structure at home. And this is particularly important if you have children also at home, which many of you do, I'm sure, and trying to keep them occupied and going along with their academic progress. So what do we mean when we talk about routine and structure? It's important to talk about. There are some real important pieces of the routine that are really important to put in place. And I think at times like this, certainly I and many of the caregivers that I'm talking with, there's a tendency to want to sort of veg out, right? To sit on the couch, turn on the television, and have that be a lot of the way that you're entertaining yourselves. And I think it's important to try and avoid things like that. Not that there isn't a use for downtime and television, but that we're finding that spending a lot of time doing that activity can actually exacerbate depression and anxiety for both you and your loved one. So what else can you be doing at this time? So one of the things that is important, maybe primarily important, is maintaining a really good sleep pattern. So making sure that you're going to bed around the same time, so within 30 minutes of when you went to bed the night prior, and getting up around the same time. And then building in things in your daily routine and structure where there are active periods and then there are less active periods. What we're trying to do here is build a biorhythm, because we know that that can help people with FTD adjust to a routine. So eating around the same time, sleeping around the same time, and having activity around the same time is really important for maintaining this structure, and also for creating that biorhythm that we know is going to help with depression and anxiety, and adjustment to this new schedule. Another really important thing to build into this is vigorous exercise. Many of the folks that are out there dealing with FTD are living with younger people with this disease who really need to get their heart pumping in order to feel calm, in order to manage, and in order to reduce that anxiety. So it's important to build those things into your day. And if possible, if it's not raining, to do those things outside so that you're getting exposure to natural sunlight, vitamin D, and fresh air. This is really important. We are actually hearing from some of our clients that they're noticing things that weren't a problem before, such as allergies, that are bothering them because they're spending so much time indoors. So really important to have at least 2 periods in the day where you're getting outside and getting fresh air and natural sunlight. And if you can incorporate that into vigorous exercise, wonderful. The combination is great. So we recommend you do that first thing in the morning, and then again in the afternoon when we tend to see folks having more difficulty with agitation and anxiety. That's a good time to break it up by getting outside. And then also important to build into the structure time for stress relief. So we've talked a lot about downtime, which could be reading a book, it could be doing some meditation. And one of the things that I've found useful in sharing with my clients is an app that I use called Calm, CALM. And they have a variety of different things you can do. So you can listen to a story, you can listen to a bubbling brook or crashing waves, or they have guided meditations. And they have these from 5 minutes up to 45 minutes. So it's really a useful tool for you. If you can only get your loved one to sit down for 5 minutes and just sit and listen to this, it can be enough to provide just a break in the activity and some downtime that's very important. Another important thing at this point is to remember that even though your loved one may have difficulty with some tasks, it's really important to involve them in the household management at this point. And if you need to do that with modification, that's okay. But that being involved in the household provides a meaningful activity as opposed to just staying busy. You're actually accomplishing something. And pointing out that you're accomplishing something is important too. So when you get to the bottom of that bucket of laundry, that's an important thing to celebrate and to be involved with. In general, I think turning off the news is a really important thing for both you and your loved one. It's not just the content of what's on TV right now and the constant news that we just are barraged with, which can be upsetting. It is important for you to stay informed. There are really good ways to do that on the internet or on the radio or through podcasts without having the television on constantly. So it's the content that we worry about. There's a lot of content out there that can induce fear and stress. We want to try to reduce that. But it's also the format of television these days where there's a lot of information coming at you. There's a lot of visual stimulation. There are multiple things going on the screen. And this can all by itself, without the content be upsetting, it can be disruptive and disorienting. And so we just recommend you avoid that at this point. Another thing to keep in mind, and I know this is something my peers and other caregivers are talking about, is that in a period of both boredom mixed with high anxiety for all of us, it's important to watch that you're limiting your alcohol intake for both you and your loved one. We have a tendency to, when we're home, have an extra glass of wine or something like that. And it's really important that we pay attention to limiting that at this point, both because it can disrupt your sleep cycle and also because you can get yourself in a bad pattern of using that as stress relief. And I'm sure everybody feels that, and it's something we all need to pay attention to. Okay. So I'm going to talk a little bit now about what you can do to avoid infection in your home and what you need to be doing to prepare for the event of an infection. I'm sure if you've been following the news, you know that the cases are rapidly increasing in the state of Massachusetts and across the country. And that our health systems are getting overwhelmed by this situation. So the more that we can protect ourselves and avoid infection, the less pressure we put on our health system. So avoiding infection is really important. The bottom line is stay at home. And I think you're getting that message from everybody in every way. But there are things you can do to break it up. We talked about walking outside. It's also safe for you to take a ride in your car and observe things that are going on around you. One of the cute things that's going on in my neighborhood, and I don't know if it's going on in other places, is that there's Find a Teddy Bear search in our neighborhood, and I've heard this is going on in others, where you can drive around and people have put teddy bears in their windows and you can look for them and find them. So that's sort of an interesting idea for a treasure hunt or a scavenger hunt, right? You can also see how many different kinds of birds you can see, things like that. To break up the time. But otherwise, you really need to be staying at home. Look into how much of what you need can be delivered. You'd be surprised now how many delivery services there are out there. And I know Instacart is one of them. Amazon is doing some delivery, but look at what they're doing, because a few days ago they did have to put a hold on new orders because there was so much demand. Individual stores are doing delivery, individual grocery stores, and now most pharmacies are also doing delivery. So anything you can switch over to delivery, you should go ahead and do that. One of the things we're going to share with you today is I sent Katie a link to, it's a short video on YouTube of a doctor who is going through what you need to do when you receive a package in your home or when you receive groceries in your home, how to deal with those packages, how to disinfect afterward, and what to do with the packaging. So we're going to share that link with you, and I think that will be an important resource for you in thinking about, okay, I've gone to delivery, but we do know that the virus can live on surfaces for a period of time. So then how do we protect ourselves from that scenario as well? A lot of restaurants now are doing curbside pickup. So you can pull up to a restaurant and they will bring the food out to you to your car. You still need to disinfect after doing that. But that's another way of taking some of the pressure off of cooking, helping support our restaurants that are still open and trying to provide food for us, and also protect yourself at the same time. So those are things to think about in terms of changing your lifestyle. If your loved one is having trouble either remembering or following through with hand washing, you might put some signs or reminders up. If reading or language is a problem, you can put up signs that just have pictures of hands being washed to cue your loved one to be doing that. I also have been working with a lot of families that just, let's use a lot of hand sanitizer. So let's have times when we're using hand sanitizer. So I have families sort of stocking that around and making sure that becomes a routine before eating, after using the bathroom, if you're having trouble getting the hand washing routine down. That's another way of thinking about it. Another really important thing to think about is how to keep your loved one hydrated. One thing we know about hydration and nutrition, but a lot about hydration, is that it fortifies the immune system. So just staying hydrated alone can help you either avoid becoming infected, or if you were to become infected or your loved one was to become infected, you would be able to fight the virus better. Your immune system would be in better shape if you were hydrated. Of course, if you're dealing with incontinence, that creates another problem. So you'll need to think through how to change your toileting schedule to meet the increased hydration. But this is an important thing to think about, and not always something our loved ones are keeping track of themselves. I recommend getting some sort of a water bottle where you can tick off, if it doesn't have measurements on it, you can just take a Sharpie and tick off different measurements so you can keep track of how much your loved one is drinking during the day. And that's one way to do. I find that helpful for myself, honestly, because I'm good at carrying around a water bottle. I'm not so good at drinking the water that's in it. So,
Do you have a recommended amount, Jennifer, that you advise adults to consume?
yeah, I mean, I think you can find that online. I think it's 8 glasses of water per day. I think if you're getting anywhere close, you're doing a good job. Most people don't drink that much water every day.
Right.
But I think it's really just paying attention to it and having times where you're drinking a certain amount and then go on with your activities.
Mhm.
Okay. What should you do? And I think this is really important given the likelihood of infection. It's still low. It's still low. But when we have folks who already have some issues that may make them at higher risk, like not necessarily following hygiene protocols. And then also some of our folks who have FTD also have underlying health issues that we need to pay attention to. And one of the things that's come up recently that I really wanted to make sure that everyone here knew about is that a lot of our clients with FTD also have sleep apnea. And sleep apnea is now being considered a risk factor for coronavirus. So this is important to make sure you're really paying attention to the directions you've been given by your doctor about handling sleep apnea, wearing the equipment, what you need to do to take care of that part of your life may help you avoid infection if you're really being fastidious about that. So I think that's something to pay attention to. And then we also know that diabetes, heart disease, and any underlying lung condition can also make us at higher risk. So, and I know several of our clients with FTD also have some of those issues going on. So that's something to really think about. It's unclear whether it's the existing illness or the medications that people are taking for the illness that make them at higher risk. Either way, it's not something we're going to stop taking a medication for. So it's something we need to be paying attention to. So what we're recommending and working with all of our clients on is how do we prepare for a possible infection? And so the first thing we're recommending is that you get in touch with your primary care physician. This would apply for you as a care partner as well as for your loved one. Some of you may have the same primary care, and that's great. If you don't, you need to be really contacting both of them and reminding them of your situation. So what's happening in doctors' offices right now is that they have a list of clients and they have a list of their high-risk folks, their high-risk patients. And by calling them and just giving them information, what you're doing is hopefully moving your file from the big pile to the small pile. You're alerting your primary care and reminding them of your situation. They are really inundated right now with calls, as you might imagine. So it's important just to remind them that you are a caregiver, that you're concerned about what will happen to your loved one if you become ill, and that this is a person that's at higher risk. And you want to mention both the FTD, but also any other underlying health issues. And you want to ask your primary care, what is their protocol if you or your loved one were to become symptomatic? What would they want you to do? In general, right now, the recommendation by the state is to call your primary care, and the reason being that they may be able to treat you at home depending on what symptoms you're experiencing. So what we're learning about the disease is that it often starts off with very mild symptoms, but then after a period of a few days, it can escalate very quickly. And so as the information on this disease is changing every single day and the possibility for treatment is changing every single day, it's important for you to know both what are the common mild symptoms and then what are the emergency warning symptoms. And so I'm going to walk you through that so that you know what they are. So the mild symptoms are fever, dry cough, and shortness of breath. 86% of people who have presented with coronavirus have had a fever. And we're talking about a fever over 100.4. Okay. There are cases where people are presenting without a fever. That is true. But it's pretty high, the number of people that have fever. It's interesting now, they're also pointing out that some people are experiencing gastrointestinal distress, which was not something they were talking about in the beginning of when this virus came out. So that's important to note. Diarrhea, vomiting, nausea, that kind of thing are things that people are experiencing as well. So when you have these mild symptoms, a really important thing to know is whether or not you suspect you have coronavirus. At this moment, you want to treat yourself as if you do. You do not want to use ibuprofen or Aleve or any of their generic varieties, okay? There's a lot of literature out there now saying that that can make the symptoms of the disease worse. So your default is Tylenol. That's what you want to go to just to treat if you have any of these symptoms, okay? Emergency warning signs are difficulty breathing. So not just shortness of breath, but real labored breathing or wheezing. Persistent pain or pressure in your chest. And we know that people who have cognitive impairment, often the first sign that something is wrong is increased or accelerated confusion. So you would want to really be looking for in your loved ones, you would want to be looking for increased or rapidly increasing confusion. Okay, that's often a sign that some infectious process is going on, and that is true for coronavirus as well. And the last thing is to look for bluish lips or face. This is an indication that the person's not getting enough oxygen. So if you see any of these things, you want to call 911. And you want to tell the emergency responders that you're having these kinds of respiratory symptoms so that they can come prepared. They will probably ask you anyway because they're as aware of this as we are, but it's important to be prepared to give that information. And another thing you may want to do is if your first calls to your primary care, if they recommend you call 911 or go to the ER, you want to be calling the Massachusetts hotline, and this is true all over New England. This works all for every state in New England, which you dial 211 from your phone, and that will give you the task force that will tell you which ER is accepting new patients. There are now a few test sites. If you have mild symptoms, your PCP may recommend that you go to one of these remote test sites. There's one in Shrewsbury. There's one at South Coast Hospital on the South Shore. And then also important to know is that Kearney Hospital has been a dedicated COVID-19 hospital. They were actually the first in the nation to do that, and now others are doing it across the country. But that may be a resource for you as well and somewhere you can go. All of these emergency rooms are now tented on the outside of the hospital. So that's where you would enter first for them to triage your symptoms, and then they would decide whether or not you needed to be hospitalized. But remember that telehealth is something that we can lean on now, and your primary care may suggest that you have a telehealth session with them, and they may suggest treatments you can do at home first. So always call the primary care. If you need to go to the ER, call 211, ask for their advice about where to go, and remember to be informing those responders about what you're dealing with. Along those lines, it's important for you to have all the documentation for your loved one put together in a place you can easily access it. If you were all of a sudden in a situation where you had rapidly increasing symptoms and this person needed to go out to the hospital, there's a likelihood that you would not be allowed to go. So you need to have all of the information for your loved one in one place. So I'm talking about healthcare proxy, power of attorney, medication list, and anything else you think might be helpful for those medical providers to know about your loved one. So, this is something that typically calms them down. These are symptoms that we typically see. This is what this person's normal cognition looks like, so that they know what's abnormal and what's normal. And then also for both of you to really think about your advance directives. Do they still reflect what you would want in this case? Remember that many people who have a serious case of this infection often need a respirator. Is that something you would want to have happen? And really think about that for yourself and for your loved one, and make sure that those pieces of information are available to those emergency responders. Again, this is all things I hope you never have to deal with, but our approach is always to prepare families ahead of time so that you have a plan and you know how to put it in action should that be something you need to do. Also very important for you to have a backup plan if you're to get sick. Who will take care of your loved one? The recommendations are, if you're having symptoms, to quarantine yourself or your loved one in a room by themselves. This sounds virtually impossible when you're thinking about taking care of a loved one with FTD. And so, quarantine may mean a different thing for you, but you need to be prepared to protect yourself if your loved one was to get ill. So you need to have the important personal protective equipment that you need in your home should this arise. So we're recommending that everybody have Clorox wipes and cleaning supplies that have bleach in them. That we're going to send you a link that Katie has from the CDC that talks about how to disinfect prior, to avoid infection, and then also how to disinfect if you're symptomatic or suspect that you're infected. And so that'll be an important link for you to have, an important resource to look at to make sure that you're following those guidelines. We're also really suggesting that people have gloves and some sort of face protection. You do not need to use this face protection unless or until someone in your home is symptomatic. But if you are caring for someone who has symptoms, you want to be using some face protection. People are even sewing their own masks now at home, and that's a perfectly acceptable thing to do. If you can't find these supplies, we have some suggestions for you. We have found some of these supplies for our clients in some odd places. So one of them is we've been able to find disposable gloves in hair dye kits. Sounds crazy, but there is a pair of gloves in every hair dye kit. And so folks who don't have gloves at home have been going and buying some of these hair dye kits to make sure they at least have a couple of pair of gloves that they can use in an emergency situation. We also have found that if you're having trouble finding Clorox wipes or disinfecting, pet stores actually have some of these supplies. And so that may be an alternate place for you to look, either online for delivery or if you went to pick up a shipment at a store. So those are things to think about. It's also important to have a plan for where you would do quarantine in your home. The suggestion is they're in a separate bedroom and use a separate bathroom. So just thinking through how that might work. And then what's your plan for yourself? Do you have family members that could step in to care for your loved one if you became ill? If you don't, what are some other plans you can make? And there are two that we're looking into in our practice that I think might be helpful. One is to contract with a home care agency to let them know your backstory and give them the information about your loved one now and sign a contract so that you don't have to do that if you're ill and you need somebody to come in.
Jennifer, just so you know, and for everyone, session 4 of our Community Forum Friday will focus on home care during the time of COVID-19. So I think that your recommendation hopefully will follow up with some real detailed information just like that.
Yeah, and there are home care agencies that are putting protocols in place about what will they do if they need to go take care of people that have symptoms or have been exposed. And so they will do that. They will do that. Not everybody, but they will do it. And certainly if anyone's in need of an agency or some sort of resource, I'm happy to share those with you. Another thing to think about either for you or your loved one is that some skilled nursing facilities are setting up isolation rooms in anticipation that there will be people either who are living at home that need to go into a facility like that to be cared for while they're ill, or people who may be hospitalized and need rehab after a hospitalization. So that's another thing to think about is I know that Hebrew Rehab and Newbridge are two places that are a subacute hospital. They have a different designation than a lot of other places, and they are setting up isolation rooms. And that is something else to look into if there's something that you come across that situation and need support.
Yeah, these are all just such good recommendations, Jennifer. Are there other things that I don't want to interrupt you? Your presentation's great.
No, I think that's the part that I had formally prepared, and I think the important part is to think through if I got sick, what would people coming in to care for my loved one need to know, and that can be down to ice cream always works, right? You know, those little details are really important if someone needs to step in. So I think thinking through that is probably the most important thing to do at this point.
I agree with you. And so we have a few questions related to going out to the store, medical issues, and personal protective equipment. So I think an easy one to address first is routine medical appointments. So how are you coaching people around their routine medical appointments, such as seeing the podiatrist or getting their teeth cleaned? I know from my experience, some of it has not been my choice, right? The dentist has called me to say, we will not be seeing you.
Yes.
How are you coaching the families that you're working with around these routine
That's a very
appointments?
good question. Yeah. I think at this point, our position is we're recommending no unnecessary medical appointments. I think a lot of providers have closed their doors, particularly dentists. And I hear you about podiatry. I have a client who is in desperate need of the podiatrist, both because of the length of her nails, but also she has some fungal infection going on. And even for her, we have decided to postpone that appointment. It's really anything that's non-urgent it's really just important to not do those things right now. You're just putting yourself at risk unnecessarily. Now, there are some clients that have things like they need to have their Coumadin levels checked, right? That is necessary for their overall health. And so I think then we're working with recommendations about how do we do this? How do we enter the building? So we've been contacting the provider ahead of time and saying, we need to come in. What are your recommendations about how we do this? And then also just making sure you're taking the protective equipment with you. You're taking the gloves, you're taking the wipes. This could be a time to wear a mask when you're in this situation if it's going to make you feel calmer. And really looking at what are these places doing, how are they changing the way that they're providing the service. You shouldn't be in a waiting room. So when you are waiting for the appointment, you may ask the provider to call you on your cell phone when it's time for them to come in for their appointment, so you can wait in your car rather than waiting in a waiting room.
That's a
Things
really
like
good
that.
tip.
Yeah.
Yeah.
Yep. Yep. But if you can avoid it, I would at this
Right.
point.
Okay, that's really good. I think one of the questions is about masks and really understanding the different types of masks. And I think we all know that there is one particular type of mask called an N95, but really that those are being reserved for medical professionals.
Yes.
And also they require training for proper fitting as well.
Right.
So I liked your recommendation around just doing your best with the masks you have available, and not even making one at home. I happen to have a prop, Jennifer. So I have a friend who likes to sew, and she has been making masks and mailing them to her friends with strict instructions to wash and dry first
That's right.
before
Yep.
wearing. But yes, I received this in the mail yesterday.
That's
So
wonderful. And you
yeah,
can
it's really
even use
sweet.
a handkerchief
Right,
or a scarf in a pinch. The
right.
important part is taking it off. Right? That's what's important, is if you think somebody's symptomatic, you need to take it off in a way that you're not then reinfecting your hands. So, removing it, putting it right in the washing machine, and then washing your hands. And if really somebody's symptomatic, after caring for them, you should really be changing your whole outfit. So,
Right.
the mask only being one part of it. So I think, these are precautionary measures. We are not going to have in the home environment the same equipment that they have in the hospital.
Right.
And that's okay, because we're dealing with one ill person, hopefully, right? We're not dealing with thousands of them.
Right.
And part of the reason, one of the other things we're finding about this disease is that there are different strains of it. And so medical professionals are coming in contact with these different strains, which put them at much higher risk for infection, or multiple infection. So really, a handmade mask that you can use at home will be what you need just to protect yourself. Yep.
Yeah, doing the best you can.
Yep.
We had a question around now, of course, people have a lot of anxiety now, just any little symptom, right? Like
Yeah.
you might sneeze and feel like, oh my goodness. And you mentioned early on folks noticing more allergies.
Yes.
So how are you coaching your families? And I think I have an idea of what you might say. If they're having just their typical asthma or allergy symptoms, and they might be worried, is this COVID-19?
Yeah. So a lot of what we're hearing is that this is a more serious. Yes, some people get mild symptoms, but really this feels very different than a mild allergy. I have allergies, and I'm seeing an increase in my allergies, and what I'm seeing is a lot of mucus building up
Yeah.
and congestion.
Yes.
Those aren't typical signs of the coronavirus. So, that's important to keep in mind. If you have asthma and you're having more difficulty breathing, it's understandable that you would be alarmed by that. I think the thing to do is to have an appointment with your primary care over telehealth to say, here are my symptoms. And It's still important to remember that only 14% of people who have been exhibiting symptoms and have been tested have actually tested positive. So that means 86% of people out there in the United States who have been tested because they think they have symptoms don't have the virus.
Mm-hmm.
So you're more likely to not have it than you are to have it.
Right.
So that should be comforting. But I also think report these things to your doctor.
Right.
Also, I think keep track. What I've been doing for myself is just writing down today, my throat felt a little, I'm like, but it's not worse, right? It's the same every
Right.
and I think that can help you. Journaling can help you to relax too, because this is something that would either continue to get worse, or some of the reports we're hearing is that it gets worse and then it gets better and then it gets worse and then it gets better. So no one that I know, even with mild symptoms that I've spoken to or read about, have said that this felt like regular allergies or an exacerbation of their asthma. So
Right. Felt different.
it felt different.
Mhm.
Yep.
Good. And then I think the last group of questions are really related back to the issue of groceries and supplies.
Yeah.
And thinking especially for our folks who are over 60 and feeling like, gee, I don't want to go to the grocery store. I'm not used to home delivery, and I don't have someone who can shop for me.
Yep.
And that makes me think about how what I've been hearing a lot in the community is that there are a lot of people who want to be helpers.
Yes.
But how do we find the helpers?
That's a good question.
Right?
So one thing I would say, and this may be difficult for people who aren't online or aren't, involved in social media, but a great place to go is on Facebook. Almost every town has a group, or more than one group. And I know that some of the ways we've been working with our families is to get on that social media, to get on Facebook and say, here's my situation. Can someone help me out? And people are really eager to help at this point. So I think that's one resource. The other resource is to think about calling your local council on aging, or even the Alzheimer's Association, people like that have volunteers that might be willing to help you out. The other suggestion I have is to call the local police department or fire department, who may know if there are people helping out with that. I know in many of the towns around me, the schools are providing hot lunches, and restaurants in the area are coming together to provide those for kids that would usually get meals at home. And some of that in some towns have been expanded to dealing with people who are older or in special circumstances. So that's also important to find out who's doing that, and could you utilize that as a resource as well.
Right. And then really it just takes, for one person to hear that Mrs. Smith needs this meal, but she can't come pick it up. I'm going to pick up my meal. I'm happy to leave it outside her doorstep
Yes.
and
Yes.
knock on the door and run away.
I hearken back to Mr. Rogers. Do you remember Mr. Rogers?
Of course.
Look for the helpers, he said, right?
Look
That
for the
was a
helpers.
big thing. And I think in this situation, it will surprise you how many people are out there that really want to help. And I think, you certainly can ask your neighbors and people around you and people in your town. You also could ask a home health agency, or there's a wonderful organization called Seniors Helping Seniors in the Boston area. And they're not a home health agency. They don't do personal care, but they do tasks like that for people to go shopping, pick things up, and bring them to your home. It will cost money, but if you don't feel like you have someone to ask, or you feel uncomfortable asking, you could hire someone like that. And they can be hired for an hour or 2 hours to go and do that kind of thing for you. So that's something to think about too.
And that's what I had heard, that home agencies were expanding their services to really just help with those personal errands.
Absolutely.
And to try your best to make a comprehensive list of what you need so that if someone is going to do that errand for you, that you really kind of get maybe you need 2 boxes of Cheerios instead of just the one, right? Yeah, things like that. Well, I think that all of the suggestions that you made, starting with the schedule and stress reduction, right? Turning off the news, really integrating times for music, relaxation, rest. I love the vigorous exercise with the emphasis on getting outdoors when it's safe to do so, right? If it's not raining, things like that. And I think also making the plan. It can be scary to think about what's going to happen. But really, I think that our healthcare professionals want you to think ahead and that the nurses in your primary care office will be there to answer the phone to talk with you about protocols.
Absolutely.
And I think that that could feel reassuring for people.
The only other thing we haven't talked about, Katie, that I think might be helpful is maybe some strategies for dealing with the added anxiety or dealing with difficult behavior at home. Because certainly there's a lot more pressure on caregivers right now. And because everybody's anxiety is higher, everybody, ourselves as caregivers and our loved ones, and if you have children, I'm sure they're dealing with anxiety as well.
Right.
So, what are some of the strategies? I know we shared this before, and maybe it would be helpful just to mention this in closing. What are some of the strategies that you can use? What are the tools you have for dealing with that behavior? And I think I have a couple of suggestions I'd like to share. The first one is to remember to be mindful of your own emotions and your own body language.
Mm.
One thing we know about cognitive impairment and especially FTD, where there are language difficulties, that while language may not be totally understood, body language and facial expression are always understood. And so, really important to make sure that you are keeping your body and your mind calm. And that sounds easy. It's not.
Sounds easy.
I understand that. I get it. And if you're feeling like you're not able to do that, removing yourself and taking a break until you feel like you can. So that's an important piece of it. I also think just acknowledging, one of the tools that we use with a lot of our clients is to remember to validate the feelings of the person with FTD. So sometimes, just validating what the emotion they're expressing can diffuse some of the emotional reaction, right? And it doesn't work every time, but it is something that we have noticed. So an example would be if someone came to you and said, "Oh, I can't deal with this," all this sort of angry expression. The key would be for you to say, "I see you're angry. I see you're upset."
Right.
And then the trick is not to say anything else, because your instinct is to say, "I see you're angry," and to say, let's solve it this way. Or, "I see you're angry, but you don't need to be angry, and here's why you don't need to be angry." And sometimes that can come across as sort of not acknowledging the feeling, right? And so then the person has to explain more how angry they are and why they're angry. And so I think that is a tool that can sometimes work to just bring the volume down, is to just say, "I see you're angry," and let that person express being angry without trying to solve the problem or redirect it. So that's one tool. Another tool is something we call Resign. And it's really important to remember this. If you get to a situation where the person with FTD is really worked up, emotional, and upset, and you've tried validation, that doesn't work, and maybe you've tried something else and that doesn't work, it's important to remember that we've learned a lot from brain chemistry over the years about how people react to stressful situations, whether they have FTD or not. So when someone gets really frightened or upset, that fight or flight reaction kicks in. And there's this phenomenon that happens, and there's been a lot of research in emotional intelligence about this, that literally there's a chemical reaction in your brain where the adrenaline floods your brain and your fight or flight kicks in. So your vision narrows and your heart starts pumping and you're preparing, right, to either run or fight. And so you're not thinking rationally. And we know people with FTD, many of them already have difficulty with thinking rationally. So now you put this chemical reaction on top of that and you've got a disastrous situation. So we often coach our caregivers that this is a good time for you to urgently need the bathroom or urgently need to take a work call or something, and just excuse yourself from the situation altogether. Because part of what we know from the brain science is if you don't continue to encourage the adrenal reaction, it will dissipate. And it takes about 10 or 15 minutes for that to happen. So you want to literally remove yourself from the situation and then set a timer for 15 minutes. And then go back and try to interact with your loved one again. And that may give you the advantage of now you're dealing with, you may still be dealing with the emotion, but you're not dealing with the adrenal fight or flight reaction as well. And so we call that resign and redirect. And that's really, resign and reapproach. So go away, let the chemical reaction subside, and then go back and try later. And these are things, these are tools. There are lots of different tools, but at least it gives you an idea of, have I tried that? Have I tried that? And then you can try them again later if it didn't work the first time. But our whole approach is to giving people tools to deal with the problems that are in front of them. And I'm sure there's a lot of anxiety and maybe more behavior than you would be seeing normally, given just the high level of stress that everyone's experiencing.
Absolutely. And, I really think that in my work with caregivers, when we can talk about it as a brain issue and really attribute those biochemical reactions, that really helps people to think about it like my loved one is experiencing this issue because of their diagnosis,
Right.
because of their illness. They're not choosing to be upset or angry with me.
That's right.
And that can really help caregivers to deal with that.
Yeah.
I think this is an unprecedented time for our global community. And what we know about our caregivers is that they have often had to be flexible and resilient. And so we're asking them to bend those resilience muscles even more these days. And that we see how hard it is.
Absolutely. And so important to get support. If you're able to build in some video chats or calls with family members, just seeing other people's faces and having that recognition of what you're going through and getting the support is really important. And, there are those of us in the community that are eager to support you and help you get through this really difficult time.
Yeah. Jennifer, thank you for all of your expertise and knowledge. Thank you for the compassionate care that you provide to so many families in our community. We're grateful for you. And I think that you're helping to improve quality of life for people living every day with dementia, especially FTD. So thank you for that.
Thank you, Katie, and thank you to the FTD unit for putting these things together for caregivers. I think it's so important, and I'll hope to be part of it in the future.
Wonderful. Well, thanks so much, everyone, and we look forward to seeing you again soon.